Assalamu alaikum, everyone. This is Fatima, clinical psychologist.
And this is Amira. Welcome to Emotional Evolution, where we focus on our own emotional evolution because when we change, life around us changes. And this week, we thought to address a topic that comes up or confusion that comes up for people between what are the difference between like clinical psych, counselling, coaching, psychiatry. So we thought that that might be a useful topic to delve into because according to where you're at in your growth journey and what you're needing, each thing can either be useful or not useful. So I'm going to just turn it over to Fatima. And yeah, what would you say, Fatima, is the biggest difference between like clean psych opposed to counseling, for example?
Yeah. Counseling is what I've learned to be a skill that we use to listen to people. So it can be really helpful. Say, if you've got a problem, you want to vent it out, you want someone to listen to you, you can feel really understood, and the counselor will sort of summarize what you're saying. They'll reflect back. So they'll put in different words what you're saying. They'll like summarize. It might make a bit of a like they'll sort of reflect back, but usually what people say is that they're doing a lot of the talking and the counselor is validating, normalizing, listening, sort of being like that nice person that responds in the way that you basically want. And so we, as clinical psychologists and psychologists, we do incorporate counseling skills, but the difference is that we're not actually sitting in a space of come into the session, talk me through your problems, vent it out, let's sit with it. I'm just listening. It's more grounded in science and what we call like evidence based practice. So, research that's been looked into different conditions, such as anxiety that continues to come up again and again, depression, or stress response, and looking at what is actually at the core of the issue, like what is keeping this stress and anxiety going. Like, is it the need to sort of because we're feeling guilty, or we're feeling scared that something bad will happen if we don't sort of do what others want. So looking at what's maintaining the problem and then coming up with a bit of a treatment plan. So it's almost like if it's like a sickness, for example, and I'm going to give you a medical example, like you've gotten sick with some sort of infection, you're given a dose of like a maybe antibiotic perhaps, or you're given a treatment plan of rest, fluids, anti-inflammatory foods. If that doesn't work in 5 days, and we're going to go to this maybe antibiotic treatment or whatever it is. So similar with clinical psychology, we actually develop a treatment plan to address the concerns and the problems that you're coming with. So it's more structured, it is more strategy based, and it generally we try to put a time limit and there's a focus on a goal. So I guess people often come to a psychologist or a clinical psychologist when they start feeling fed up with, I've talked a lot about it, I wasn't really focused, it was really good that somebody listened to me, but like I want some strategy, I want a plan and a focus. So this is really where the evidence base and the science marries, and we look into what's keeping the problem going. And this is like a 10 or a 20 session or a 30 session plan to help address the issue and the pattern.
That makes sense. And I like how you honed in that point that there is like a time and a place where someone needs to go through a season of venting, a season of like expressing and being understood and heard, because that's um, a key step in order to change. We need to, and I know in parenting they said this, and I know I've said this before, like connect before correct. So we need to feel connected, seen, and understood in order for us to feel like, okay, I'm totally understood in my issue. I'm totally seen in my issue. And now I want strategy to change it. So if you feel like you've been in a situation where you're getting some help, but the needle is not moving, it's from what you're saying, Fatima, it's because there hasn't been an evidence-based practice. And I want to go into a little bit of coaching because
Just before,
Yeah.
I was going to interrupt you. It's not to say when you see a psychologist or a clinical psychologist, you won't have that space where they're sort of understanding the problem. There is like a bit of an assessment phase where you're working together to understand what the issue is. So definitely you are being heard, but you're basically not being held in a space for months and months where you're just venting. There's a structure, and that structure can be flexible, but it's sort of more result, like based on a result, an outcome, a goal that comes from you.
And I just wanted to bring up one thing. Sometimes when a clin psych or someone who does deeper work, like deeper work in the sense, I don't mean that's more valuable work, but it's a different lens
Addresses the deeper issues
issue.
that like keep that
Yeah.
pattern going, something that's gone all the way from childhood,
Yeah.
like some of the work that you do with what some of the work that your approach.
Yeah, mine's more like those egoic traits or those schemas that I pick up on, and I basically try to wedge those schemas out of someone or shift them. And when
Just for people that didn't listen to the previous podcast, what is the egoic state or schema?
So it's basically like your whole like belief system and behaviors and thinking patterns and habits. So actual thinking habits and patterns. So you're literally automatically go into that type of thinking, automatically go into that kind of catastrophizing or conclusions that you just might make up in your head about relationships, about life, about how you see things turn out or not turn out in your life. It's that kind of presentation and looking at how your thought form is not serving you and what category do you fit into, like what schema do you fit into, and what is required for you to actually shift from there. And when we do that type of work.
Is there any example you can give? I know we talked about sacrificing. Is there any other common example?
Oh, I wanted to give an example, but one thing I really wanted to hone in on was that in that type of work with, for example, someone like you or someone like me, we do have to get confrontational, not in an aggressive way, but in a way where we might need to challenge the person that we're working with. Because when you're stuck in a state, sometimes you can't see where you're stuck, and that might feel uncomfortable. But that's what's going to make you move the needle. So the distinction I wanted to make is that it is normal to feel like you've been confronted and feel uneasy. If your practitioner is really good at what they're doing, they're not going to be afraid of confronting you where you need it, because that's what's going to get you to move the needle. If you feel like you are not getting the change, most likely that person isn't confronting you. Most likely they're using more of a counseling approach, and that does serve its purpose. But also to help you in this journey, if you are on the journey, is asking yourself the question, how well am I receiving feedback? So if they're telling me I'm not doing something, they're seeing me from a lens that I can't see myself. Can I just take on what they're saying, even if it feels uncomfortable? Because and if they're a good practitioner, they're going to be open to hearing how you're uncomfortable with them confronting you.
You generally at that stage where the confrontation comes up, it's developed on a relationship with your therapist. So you will feel that sense of trust. They've understood you, and then the intention of your practitioner is to point out a pattern or something that's keeping you stuck, because they can see it's not going to help you move forward. So it's almost their responsibility that they sort of point out to you, like, oh, like this seems to be getting in the way. So it's all out of a place of care and like working on you, not confrontation as in like, something really bad and scary, but it can feel like a bit, full on when, we realize that, oh, this is something I've been doing and I didn't realize.
Yeah, like it might look like it's not about rights or wrongs. It's about how our own thinking and behavior or reactions are fitting into a pattern of what we're not wanting. So if we're like, for example, in an unhealthy relationship, sometimes even not doing something is doing something. Like no action is also a position that we're taking. So if
like
you're
avoiding
conflict, avoiding conflict,
because it feels more peaceful.
Yeah, it feels
but then I'm not sort of saying what I actually want because it feels like too uncomfortable and another person will react.
So you're not moving the needle. So you might want a change.
You might want to feel more connected in the relationship, or that there's more love, but you won't
yeah, you won't get to that point unless you change as a person and you actually take some action or voice something. So that's a kind of example. I actually wanted to go. So we've touched on like the difference between like the counseling and the clean psych.
Yeah, what's the coaching
Yep.
lens?
So we both have done coaching as well. So with coaching, from what I know, it varies. There are coaching courses that you can do as a practitioner that only go for like 6 weeks. There are coaching courses that go for 6 months, and there are coaching courses that can go for years, like 3 years plus. And often coaching offers more strategy. Is that what you would say? Strategy and perhaps alternative way of thinking and information. And I have rarely seen coaching with a whole lot of accountability in a way where it factors in mental health. So it does have its place and it is really useful. However, if you feel like it's not working, it might be that your, like, as Fatima like mentioned, your schema or an egoic pattern is getting in the way. And that's where you could like utilize coaching alongside with therapy to help create more change. But from my understanding, coaching is more like information and an exercise to do alongside that information. What would you say, Fatima?
Yeah, I'm just thinking about an example. Like if somebody's got a weight issue and they feel addicted to food, a possible coaching strategy like might be like it could be a suggestion like, make sure that you fill up your stomach with some nourishing foods before you go to the party so you're less hungry and you're less likely to eat that sort of piece of cake. That's a very simple example. It can get more nuanced, but it doesn't look at the barriers of what's actually driving you to be addicted, what needs are being met when, I mean, it can go into that too, but it's psychology. It does look at mental health based on research and strategy. um, yeah, whereas coaching is more, I mean, there can be really useful principles, but it sometimes doesn't go as deep, or there's not like a very set treatment plan and session to session sort of things change.
I can talk from my own experience, and I'm not shy to be open and vulnerable. I've done both, so I've studied it. I've studied both psychology and coaching, and I've also had a coach and multiple coaches and psychologists. And from what I've noticed, the ones that really move the needle, they have a deeper understanding of both. So with coaching, what I noticed was a hurdle for me is like sometimes they'd give me an action item, but for some reason I noticed I couldn't move it. And that was because my own schema or my own egoic trait was in the way. And that egoic trait serves a purpose. So until I heal it, it's very hard for me to push past it. Most people will just reject it. They will reject it. So if you're saying, for example, let's say you have like a relationship problem with a parent, and someone's like, we'll do these 5 nice things for your parent. If you have like, and this is not me, so this is an example. If you have like deep resentment towards a parent or hurt, you're going to feel like you're actioning out this thing of doing this nice gesture for your parent, but you're feeling resentful and you won't be able to do it. So that there's a limits that come in between with the coaching. Like it serves to actually get that deeper understanding of like psychotherapy understanding or the inner trauma understanding or the inner child understanding. So you know how to work with your feelings, and that coaching bit is useful because then you can take those action steps as well. So that's what I would say is the difference. What would you say then is the difference with psychiatry, Fatima?
Psychiatry, they basically study medicine and then they do like a bit of a specialty in mental health, and it's more for treating severe psychiatric disorders with medication. If the psychiatrist goes on to do their own individual training, they might learn some strategy to help manage, but people typically see often, there's like what I see with people that do see a psychiatrist, if they're managing something like schizophrenia or bipolar or could be ADHD, it's less of a lifestyle change and more so monitoring your medications and your general sort of well-being. and then they'll go on to see like a clinical psychologist to get the lifestyle and the how to of how do I change the thought patterns and the behaviors and the emotions. And I do want to add, it does depend on the practitioner as well, because you might even get, like, for example, a general psychologist. They're not very specialized in mental health. They a general psychologist, or depending on the person, they can give you more general strategies like Amira was mentioning earlier. But the practitioners that end up doing the deeper work on, like, for example, the schema work and the intergenerational childhood patterns and the belief systems that form early on, they will help with sort of healing and reducing the intensity of the emotions that come up, the thoughts that you have about a situation when you're sort of feeling, guilty or stressed, and then also the behaviors that you end up taking. So it ends up being more a long-term sustainable change rather than just a little bit of a short-term sort of coping strategy, or something to make you feel good for the next month or two, something more long standing.
I think the thing I really wanted to bring in is that often people think that their issue is something that they can't fix. But when you do like schema work or the egoic work, you can fix it. There is a solution. And even if the solution is not what you wanted, you'll still feel very resolved because you've actually worked on those like egoic patterns. You won't feel, even if you've had to do something completely opposite to what you thought you wanted or needed to do, there will be like this internal peace within you. You'll feel very resolved. And I think that's the beauty about it. Knowing that if you are yet not feeling resolved, that means you haven't probably found the right person yet. And you need to find that right type of practitioner or type of therapy, because not all, like from what you would know, Fatima, that not all psychologists do the same training. There are so many different types of trainings that you can do. And depending on how you are as a person, you might not gel with that therapist style. Like what their line of study and like the methods they use, they totally might be like contradicting with what actually moves the needle for you. And that's why it's important to kind of do a little bit of, like, just how you do window shopping, do a little bit of therapist shopping, like try on and see how do you feel like that method works for you. Because often the therapists that are the best, they have invested in themselves. It is not like cheap for them to learn all these new strategies. I know for me, even though I'm not a clin psych, it was not cheap. I kind of did yearly investing in learning different methods. And it's a rare thing, really. I don't think it's a common thing for people to like really invest a lot of time and money in that continual learning. But when they do, like your patients like get a really good outcome.
I think even just to give a snapshot, I spent 7 years of study, undergrad and postgrad, in working, and then training, and then paying for additional trainings to learn more deeper nuanced therapies. So it's a continual, your practitioners, if they are invested in sort of getting you the results, and like they care and they've got that growth mindset, they definitely will continue to be investing in themselves to help invest in you as well. So just sort of see how it goes. Try on for size. We also have a podcast on looking at what makes what was the podcast? It was something about therapy, how to find, like, why is therapy not working. So you can review that for a bit more of an in-depth discussion around this topic. But I think is that sort of it for today?
Yeah, I think that's it in a nutshell. And we just want to give you a take-home task of like looking at where in your life you feel like a situation is not working, or you're noticing that you're not your best in an area, or there's a dynamic that's not its best. And how would you feel if you resolve that? And where do you feel like you're at with that? Do you feel like you're at a point where you want to take action, or do you feel like you're at a point where you want to vent it out? And then accordingly, I would encourage you to get that help. Get that help through whoever you want to find, the person that you feel like works for you. Because I personally believe when you invest in yourself, you don't need to go on a holiday. Like, you're happy within you. You feel calm in your day to day. You feel at peace. And why not? Why not have that? Because life is going to bring its challenges. And you don't want to be like waving around in the wind like a flimsy like palm tree. You want to feel like strong and rooted like a good old oak tree, and flexible enough as well that when you are met with challenges that you can bounce back, inshallah, instead of silently suffering in an area or holding like a little a,
Or cracking or breaking,
cracking,
like
breaking,
that
or a little
ritual.
habit or pattern that you're not proud of. So
Mm.
inshallah, why not? Anyway, we'll leave you this week, and looking forward to sending you guys some content for next week, inshallah. Assalamu alaikum.
Assalamu alaikum.